Gil, you'll also be doing an IV. So IV, throw that pulse ox.
It's day 2 of the Joint Emergency Medicine Exercise 2023 on Fort Cavazos, and Captain Eker and her team are going over plans on how they'll treat casualties. It's the calm before the storm. Moments later, the storm arrives.
Right leg is gone, he's unconscious.
Although the situation seems urgent, everyone knows their role and remains calm, even though this is the group's first time working together.
I think it's always very difficult when you're grabbing a whole bunch of people that don't know each other and you throw them into a scenario that they're unfamiliar with, especially at a Role 1 situation and point of injury. And so a lot of the people on my team haven't done any of this before.
The subject matter experts turn up the difficulty, yet Captain Eker and her team's ability to remain calm is remarkable.
There are things that we can do to dial up the pressure, but that pressure doesn't need to be dialed up like in an unwarranted fashion. We need to do it because the objective here is to learn. And if they're not learning, then we're just training them to the point of failure.
So let's go ahead and activate walking blood bank. I want to initiate some blood.
This is nothing new for Captain Eker. She's an emergency room doctor at the Carl R. Darnall Army Medical Center. And an ER is a place where crisis can happen at any moment.
He's got blood in his mouth, he's gargling.
I think the person running the scenario or code or whatever it may be, trauma, if it's in a, whether it's in the field or in the ER setting, has to be calm. Because ultimately they're going to look to you. And if you're not calm and you're not collected, then your team's not going to be calm, and then everything's going to fall apart.
The situation seems chaotic, yet Private First Class Gil, who's only been in the Army for about a year, doesn't panic as she tries to learn as much as possible.
So I think I'm calm because I know it's just a mannequin and I know it's just training. In a real world situation, I think that I would not be as confident or calm. I'd probably freeze up a little bit and get nervous. I tend to be a very anxious person and I overthink when I'm doing things. But hopefully, this training will make me better at doing that in a real world situation.
Hey, how's it going?
Can't talk to you. Entry wound above the right mandible that extends through the left lower mandible.
I think that's why this training is so important for people like PFC Gil. So ultimately, they're going to get some experience out here, and hopefully when they go off to their next units, or even if they're in their deployed settings and they got to get thrown into different roles, they'll remember what they're learning here out at this training and then take that with them.
Real bad. You guys got meds? No meds around here?
Hey, you can go follow him. You can follow him.
No, man. I need meds right now, man.
Key thing that we wanted them to do is really just to work through the adversity and the unknown, and then to come together in their roles and really give the best care to the casualties that they could. But I think overall they did pretty well coming together as a team.
I think all of them worked very well together. It's a huge learning curve, and so I think hopefully every day everything gets better and better and better.
It's hard to say how these medical professionals will react in a real-world situation when lives are truly at stake. However, Captain Eker and the rest of her team's ability to remain calm is a good sign. Rather than panicking during training events, they'll be able to remain calm and learn. The more they learn, the better equipped they'll be to save lives. Minnie, Cardamsey Public Affairs.